Hello, everybody. I'd like to welcome you to this webinar, which has been organized by Erchonia with Mr. Robert Sullivan presenting to you all. I just wanted to come on first. I'm Simon Ramshaw. I'm a managing director of Erchonia Lasers Limited, and we are the subsidiary organization for Erchonia Corporation for Europe, Middle East, and Africa. I've been lucky enough to work with Rob for quite a few years now. We started back in 2012, where he did an independent study looking at toenail infections. For a lot of you who are in Europe, the way things work in the UK is whenever there is a surgeon or a clinician who becomes a surgeon, they change their title from doctor back to Mr. So for many of you who don't know why we don't put Dr. Robert Sullivan, it's because Robert is an orthopedic reconstructive podiatrist, so he does surgery, so he qualifies in the UK as a Mr., whereas in mainland Europe, it would be as a doctor. So as I said, Robert's a very progressive orthopedic reconstructive podiatrist. One thing I've always liked about Robert is that he thinks outside the box. He doesn't pigeonhole himself into specific areas that he is qualified in. He likes to expand his scope of practice, and he always encourages clients to do the same. Due to the experience we've had with working with Robert over the years, we have drafted him on board as a clinical consultant to Erchonia Lasers Limited, and he now is responsible for all training infrastructure and is a clinical consultant responsible also for some European studies that we will be commencing as soon as the medical device regulations come in, which is due to be the end of May. So Robert's special interests include non-thermal lasers, pain management, fat cell management, and immunology. And a lot of you will probably seen the blogs that he has actually done, which can also be found on our YouTube channel. So without further ado, I'd like to hand you across to Mr. Robert Sullivan.
Thank you, Simon. It's strange when you hear Simon talking, I kind of looking over my shoulder and saying, is he actually talking about me? Anyway, I'm going to talk to you today about fat cells, and I want to, we call this the light approach to fat cell management. The reason for that is we're using non-thermal low-level lasers. So the kind of lasers that we're using, there are two. One of them that I use in clinic here is Zerona. The picture you see there is Verju, which is a green laser. So fat cell management takes up really many aspects. As you know, Erchonia lasers are, Simon's going to do the sales spiel at the end if he wants to, or he's going to talk to you about more at the end. So I use these lasers in my clinic from Erchonia because they're the only true non-thermal low-level laser that are out there. So I use them for body sculpting a little bit. Anybody who knows me knows that I could do with some of that myself. I use them extensively in weight management and prediabetes and obesity management. For those of you that know me, I'm quite a big guy. I'm 50 kilos now lighter than I used to be, and I used the Zerona to get me there. Also use these lasers in accelerated wound healing, pain management, pre and rehabilitation. And we also use them in neurological management. So that's things like Parkinson's, Alzheimer's, ADHD, autism, that kind of thing. And of course, the original for me that brought me into all of this was fungal nail infections. So today we're going to talk a little bit, as I said, about the fat cell. So just a brief overview of the fat cell itself. Then we're going to say a little bit of what we know about research into fat. Then we're going to look at the patient experience, because what's very important for me in my clinics is the patient experience, because I'm not into, hello, how are you? Yes, I'll give you a prescription. That's very nice. Thank you very much. Bye-bye. I'm very much into giving my patient a valued experience where I value them, they value me. I could safely say I don't have any patients anymore. I have a lot of friends, who come to me for advice one way or another. Then we're going to look at concepts of internal beauty, and we're going to draw conclusions, and that will then lead into a future lecture which will be about beauty is something which is no longer skin deep. So what do we know about fat cell management? So I confuse people a lot when I talk about fat cell management because nobody really I think understands what I'm saying. And when I talk about fat cell management, what I'm talking about is a lifelong process to assist the body in maintaining good metabolic, glycemic, and healthy control within a relatively healthy weight and within a healthy lifestyle. So that's the founding principle for me of fat cell management. So it's basically me taking responsibility for who I am, me taking responsibility for my health and what I eat, and me taking responsibility for my lifestyle. And then sometimes when we lose that management, we need help. So that help can come in terms of some form of counseling, some form of diet, which, as you know, if you get to my age, I've tried them all. Diets don't work. So sometimes we need some more integrative assistance. And that's where I use non-thermal low-level lasers, because these will assist in weight reduction. They will assist in the management of obesity. They will also assist in weight maintenance. So take me 50 kilos lighter. We're in the middle of a pandemic, and as a result of that, I tend to graze a little bit more than I should. So I have to look at weight maintenance. So I started last week having some treatments myself with the Zerona to try and get the 2 kilos off that I have managed to put on. The other thing that I'm going to use it for here is body sculpting. I try not to body sculpt because it's not my area of like. The reason I tend not to do it is I don't have the patience sometimes to deal with Twiggy who thinks that she isn't Twiggy and really needs the skills of a psychiatrist and not me. So that's my choice, but in aesthetics, it's a very, very important thing. And it also is great in terms of it helps the psychology of the person. A very interesting part about non-thermal lasers is when we start looking later on at the green laser, excellent at reduction in cellulite because of the affinity the light has with the underlying collagenetic function of the cell itself. So let's take a look at a fat cell. Fat cells have a mitochondria. Mitochondria in terms of non-thermal low-level laser is vital because within the mitochondria we have cytochrome C, which is our photosensitive protein which drives electron transport and ultimately, as we will see later, results in emulsification of fat and expression of that fat without damaging the fat cell into the lymphatic system as free fatty acid. Just a note on that before we get there. The World Health Organization years ago reclassified fat cells as part of our endocrine system. And when we think of a lot of the therapies that are out there at the moment, I took an oath when I qualified to do no harm. These lasers do no harm to our endocrine system or our fat cells. So again, we have the Golgi apparatus. We all know about that and its spiralization. Then the main part of the cell is the fat reservoir, which is mostly of triglycerides. And in this example here, this is a white fat cell, not a brown one. Then we have the cytoplasmic membrane around it, and then we have the membrane itself. This in turn makes up the fat cell when we add it to the nucleus. So all of that together is a fat cell. If that were to be a brown fat cell, it would look pretty much the same, except instead of there being one big reservoir of fat, there would be lots and lots of reservoirs of fat within that. So what we're really talking about is adipose tissue. And as we all know, fat is often seen as the enemy, and it most certainly is the enemy when we get outside of our comfortable body index. And when we talk about body index, it's important to remember that what is fat for me is not necessarily fat for everybody. What is skinny for me is not necessarily skinny for everybody else. So even though we have the BMI, I look at patients differently and I look at them in proportion. So if my patient looks in proportion and they're happy with that proportion, then we've done a good job and fat no longer is the enemy. But when we think of fat more outside of the box, without fat, our nerves would jangle together. We would have masses of cross communication within our body simply because our nerves would be shorting off of each other because they wouldn't have that myelination that we need. And other things too, our fat is actually a very critical store for vitamins, minerals, and it also has a function into our immune system. It also tells us when we're hungry. It also has a function into whether we have diabetes and whether we don't have diabetes, and we'll get onto that a little bit further down. But I think really we need to start understanding fat a little bit more and appreciating how we manage to arrive at that place. So as I mentioned there earlier, we have brown fat and white fat. If we look at some of the more modern research over the last couple of years, we will actually see that there is a becoming belief that in order for us to lose weight without an intervention, the body has to go through a process of changing fat from white to brown in order to lose weight more effectively. Whether or not that's the case, the research is still out there being done. So as you look at that statement there, you can see, as I have said, the difference between the white and the black, sorry, the white and the brown, without getting too technical about it. So even though these brown fat cells are fat cells, it's the structure and the makeup of the droplets of fat within that that is different. And it's also the fact that there would be quite high concentrations of iron. If we take kids, for example, newborn kids up to the age of 13, 14, they have considerably more brown fat because they shiver. And shivering is important for babies because that keeps them warm, and that's the brown fat doing its job. So maybe if we had more skinny children, it would be because we let them be a little bit cooler and they shivered a bit more. Maybe that's another way of treating all of this. So clinical data. Erchonia is a research and development organization. So everything that they do is heavily founded in research, and it's very important to understand that it's out of this research these lasers come. It's not a case of these lasers come out and then follows the research. The research is the father of the instrument. So the original red laser and its FDA clearance was basically for circumferential reduction of the waist, hips, and thighs. It was designed to be non-invasive, and it has always been non-invasive. And initially, it was as an adjunct to liposuction. And the idea was that the fat that was removed from the cells would be of a better quality and easier to take out. The treatment was seen to be safe, it was seen to be effective, and the important thing was it was seen to be non-temporary, which means, again, or it brings us back again, if you like, to what I said in the beginning was maintenance. These lasers are excellent for maintenance because we all fall back into the chip bag from time to time. So it was a non-thermal and is a non-thermal low-level laser system for the removal of fat from the adipocytes, basically without damaging those cells. Because would I want to damage my liver? Not really. Why would I want to damage my fat cells? It's part of my endocrine system. So when we look at the first generation red lasers that were FDA cleared, the clinical study results from 2010, it was 3 treatments per week for 2 weeks. And when we put side by side the active group and the sham group there, you can see the difference between them. You're looking at 9.1 centimeters average reduction in the active group. You're looking at 1.6 average reduction in the sham group. Interesting point, the sham group, it was LED as opposed to true laser. So here is when we look at our baseline measures and we compare them, you can see there the difference again between the sham group. So you can see an overall reduction there of 9.1 versus 1.68 centimeters average. And that's basically using something that caused no pain, and it was a nice, restful, soothing experience for the patient. So how much fat is that? So if you think of it, for every 3.5 inches or 9.1 centimeters, that is approximately 1.8 liters of fat released into the system and safely metabolized. So think about that for a minute. The amount of fat that is released in such a small space. How can we improve that? This is where Verju comes in. Verju is different insofar as it is a green laser. It's probably, as you'll see from the research, about 25% more effective than the red, with the added benefit of being able to treat cellulite as well. And remember, in the current day, we see men with cellulite as well. So again, coming from a study point of view, double-blind, sham-controlled study to demonstrate the effectiveness of this 532 nanometer green laser. Again, for contouring of waist, hips, thighs, and cellulite. So here's your baselines, again, with your comparison. So in your green laser, we're looking at 11.4 centimeters. So that's a 25% improvement and 25% less time. And as I said, with the added benefit of being able to treat cellulite as well. So let's briefly take an overview of the action. So just to go back, sorry about this. Don't you love technology? Nobody can mess it like I mess it. So let's go back again. Okay, so that isn't going to play, but what I was playing for you there was an animation of this real-time fat cell. So what you're seeing there is a transitory pore forming within the cell. The last slide was basically an animation of a section of skin being irradiated by the green laser. And what it actually was showing you was that this green laser, the light is uptaken by cytochrome C, which changes adenosine biphosphate into triphosphate, which feeds our electron transport chain. We would see releases of free nitric oxide in our electron transport chain. We would see reactive oxygen species. And we would see an expression of H2O2. And as we move down that cycle, we see upregulation of inflammatory biomarkers, our interleukins, and ultimately what we see is the emulsification of fat. And when we have this emulsification of fat, it creates, as you see here, a transitory pore in the membrane of the fat cell, through which the free fatty acid is expressed out into the lymphatic system, where it's available as a nutrient supply for muscular activity. So a little bit of walking, movement, light exercise will burn off a considerable amount of that fat. Anything that isn't is going to be picked up and excreted from the system through phagocytosis. And anything else that's left will be redeposited and taken up into available fat cells.
Robert, sorry for interrupting. It's working okay on my presentation. If you want to swap screens or at the end of the presentation, we can do it. So let me know.
Okay, we can come back to it at the end, because you know me, once I start, I can't stop. So I'm gonna take you now through the studies. Studies are something that it's very important, because after Erchonia, who I have said to you are research and development, after they have done the research and the development, they produce then this laser. Now that has to go and that has to be sort of verified through peer review after its FDA approval. So let's look at some of those studies, because I know for me there were a lot of questions. And these questions are very important, especially in terms of what happens to that fat, what chemical changes happen. So over the last 20 years of research, there have been 20 peer-reviewed publications. Each scientific publication has a purpose and is used to answer a particular question. So for those of you like me who are involved in research, you know that research can be a pain in the bum because it only answers one specific question. So the papers that I'm going to show you now, they're answering specific questions. So in order to go through this more effectively, I want to give you the what I like to call the evidence trail of action of Erchonia. So these are their clearances. So if you look at the dates there starting at 2002, that's grayed out, and the reason that's grayed out is it doesn't pertain to the current lecture, but it's important in terms of the train of events. So 2002, basically it was clearance for 635 nanometers of red light, and it was used to treat chronic neck and shoulder pain, and it was delivered from a handheld device. The reason for including this in is Erchonia has a story. This is the story of what they have done in terms of their devices. Simon may wish to elaborate further later on in terms of their history. So also at that time, it was an adjunct therapy to liposuction, again handheld, and that's, like I said to you already, the quality of the exudate to make it easier to get out, so you get less ridges from the cannulization as you were taking the fat out. So 2004 again, acne handheld. Actually, no, 2004 is in 2002. It's just the edit of the slides has slightly slipped. So 2004 saw post-surgical pain in the breasts being treated again with the 635. It saw the hips, waist, and thighs approval of the Zerona 635, the first generation machine, and that was, as we've already said, three times a week for 2 weeks. And finally, we move on to the Zerona Arm, which was a device that looked very interesting, but with more and more use, it became kind of redundant, because the Zerona 635 first generation was able to treat that without needing a second machine. So as we move on, 2013, again, waist, hips, and thighs for the 532 nanometer, which is the green laser. Green laser as well, it's not just used in fat cell management. It's also good for elastic management in terms of creating tightness within tissues. It's also good insofar as it stimulates the lying down of collagen and collagen reprofiling. There's a lot that it can do. If you haven't seen the lecture that I did last week, then get Julie to send you the link, because there's a lot more about what the different colored lasers do, and I would hate you to miss out on a possible inclusion of it into your practice. Again, at that time, there was chronic heel pain, which was plantar fasciitis, and that came from, again, a 635 nanometer laser called the FX. 2014 saw approval for a little bit of obesity work with the Verju, as you can see there. And then we had the reapproval of a protocol so that it was now used once per week for 6 weeks on the Zerona Z6. And then finally, going through this, we had increased clearance of nail growth for onychomycosis, which was the lunula, which I always say wrong. And then, of course, we had pain reduction in the lower back. So as you can see, the journey has been long. The research has been extensive. The assistance that can be given across the whole spectrum of the body is high. And the reason for that is that laser is just a delivery system for light that our body uses to repair and maintain itself. So, as I already said, each scientific publication has a purpose, and it answers a question, and also usually poses another. So for Erchonia, research began back in '98, and as you can see here, it was again the liposuction, pain related to that. And the important thing about all of this is, as you heard me say earlier, once we hit that cytochrome C, we create a cascade process. The body then utilizes that process. And the reason that we're getting not just pain relief, but also that actual emulsification of the fat is because of the action of the laser and how the body deals with that. So Nerea observed changes in adipose tissue structures, and what he absorbed was he had a softer state in terms of the fat that he was working with. It was less fibrotic, and like I already said, it was easier to suck out. And when this was looked at from a histological point of view, it was basically confirmed that the laser was having that particular effect. And as a result of that, it was easier for the fat to be processed by the lymphatic system. Nice way of putting it there, liberated. So why non-thermal, low-level lasers? Really, for me, having tried to prove that lasers don't work and proving that they do, it's become pretty much a no-brainer, because non-thermal low-level lasers delivers a balanced energy dose. And the way that it does that is so subtle that it's working pretty much similar to how a drug works within the body. The important thing with it is laser needs to be delivered at an appropriate level. And the appropriate level really is less is more. So when we look at thermal lasers, we're always talking about joules per square centimeter. In the past, when this research was done, we were still looking at low-level lasers in terms of joules per square centimeter. But what we now know is that once we have the wavelength to deliver that energy, we have a product that interacts with the system, and that product is light. So Erchonia are using the lowest possible amount of energy to generate a stable laser beam in order to create a therapeutic window within the cell to bring about a specific effect, in this instance, the emulsification of fat. And the important thing to remember about lasers, all lasers, is it has to be coherent, focused light, not scattered. As I said, we use LEDs in sham studies, that's scattered light. So if we go to Jackson et al. 2010, we start dealing with questions. So if I'm going to release all of that fat into the system, what's it going to do? Is it going to take my sugar levels up? Is it going to affect my cholesterol? Is it going to deposit elsewhere in veins and other places? So basically, what Jackson and his colleagues found was that it didn't. It caused a reduction. It caused a reduction in cholesterol, which is interesting because it shows you that the body has everything it needs for a healthy life. The only thing that's missing sometimes is the stimulation for it to act in a certain way. And I think if you have a read of this paper, you will see that the body is acting in a certain way, which at the time we didn't expect, but we now know acted in that way as a result of the energy being delivered and what the body does with that. So this paper was basically widely published, widely read. Again, it's in the cosmetic realm. And when we look at it, the purpose of the study was to demonstrate that non-thermal low-level lasers does not have or cause changes within serum chemistry within the blood. And basically, it didn't. So the methods there that you can see, I don't need to read them to you, and you can review this again on the video after. Again, you know, this was all reviewed and peer-reviewed. So the results were interesting because if we have a look down there at triglycerides, total cholesterol, and then if we look at the rest of the chemistry across there, you can see your baseline, you can see your post-procedure, and you can see your difference. So what you're actually looking at there is a positive effect of the laser on the blood chemistry through cellular interaction and through emulsification and expression of fat. So another study, Jackson likes to do a lot of studies, it would appear. So this is 2012. And this is looking at how do we know that fat hasn't been dispersed to other areas of the body. You know, if I'm going to remove fat from hips, waist, and thighs, how do I know it's not going to end up in wings and chins, for want of a better word? So when we look at studies around this, again, applications of low-level laser therapy for non-invasive body contouring. It was published in Laser Surgeries in Medicine. And as you can see, a relatively large study. And the conclusion was that it does not deposit or redistribute in other areas of the body. So now we're starting to build a portfolio that says, not only does this do what it says on the tin, but it does it in a way that has improvement benefits on the health generally. So not only are we getting somebody to reduce their circumference, we're getting them to do that in a safe, effective way that has far-reaching implications into the rest of their lives, because we are, as you will see later, re-educating the body. So safe, effective ways of doing things. So the other thing that this study was doing was it was looking at long-term efficacy across the period of the study. And if you remember at the beginning, we said that this lasted for time. if I go and I do a diet, it doesn't last over time because I basically can go and put that all on a little bit more quickly. What this is basically showing is that because of the interaction with the body chemistry, the person is able to maintain themselves more effectively. This study then is, as I was saying to you, about the laser specific for the arms. So body contouring using 635 nanometer low-level laser basically has far-reaching therapeutic interplays with the body, which are hugely beneficial, and we're looking at something that will last considerably longer than a couple of weeks of dieting. So when we look at first generation Zerona versus Verju, you're talking about 635 nanometer laser versus a 532 nanometers of laser. Again, it's the electromagnetic spectrum, and there were significant result differences between them in terms of what happened. According to the FDA, and I like this statement, according to the FDA, there was no need to do further studies with the green laser. And the reason they didn't need to do that was because we'd looked at the systemic effects as a research organization. We looked at the cholesterol effects. And as both wavelengths were similar and the delivery mechanism was the same, the FDA basically said that, you know, we didn't really need to do too much because we'd already identified the proprioceptor, the photoreceptor that did that. But what we knew was that the green laser delivers more photonic energy, but it does it in a way which is, I like to say, smooth, less sort of more gentle to the body, completely different experience. So getting away from Jackson, we now have Roche et al. 2012, looking at 532 nanometers of green laser. And what I've done here is I'm putting our comparisons one over the other so that you can physically see them. So laser, again, 25% improvement in the outcome with the green laser and 25% less time. And there's a slide coming up later where I've mapped one over the other. So 2014 saw new FDA cleared protocols. The reason that's important is every time that we want to change something, in order for us to do that, the FDA has to approve that. So there has to be extensive research going into that process, and we need to be able to stand over the evidence that we are actually presenting. So again, if you look at your chart there, it's broken down into right thigh, hips, upper abdomen, left thigh, waist, and it's done in mean inches. Your conversions are there on the right-hand side. I would invite you to have a look at those when you are reviewing the presentation. So I think the important thing with these machines are they are very easy to use. We can create an experience for our patients around them, an experience which takes us pretty much into a different realm of medicine. It takes us into the restorative, rejuvenative world of medicine. I talked to you a little bit about that later on. What I'm going to do now is I want to show you some of the before pictures and some of the after pictures of patients from various settings and clinics. So have a look at that. And basically you're looking at 8 treatments over 4 weeks. So that's basically 2 treatments a week, and comes from one of the clinics in the UK. And I think when you look at that, you can definitely see the differences there. So again, here's our before, and here is our after. So 10 treatments, 5 weeks, 2 treatments a week. The important thing about that picture for me is if you have a look at them, you can see the difference in that time in the collagenetic profiling in terms of the cellulite presented by that patient. And because we've started a process going there, think of it, the body has everything it needs for a happy, healthy life. The only thing it's missing sometimes is that inspiration. That body has had 10 weeks of inspiration, and the cells are now behaving in a younger way. That profile that you're seeing created by the laser has inspired the body to resynthesize collagen in a completely effective way, as you can see from that. So moving on again. Not the best of pictures, but I think you get the idea of what we're saying. So again, our befores, and again, our afters. Huge differences there. And a more mature patient, somebody my age. While those slides are up there, I just want to talk to you a minute about the Zerona, the Verju experience. We all live inordinately busy lives. We don't have a chance, as we would say in Ireland sometimes, to bless ourselves because we live oversubscribed lives. I think the one thing that we're learning in the current pandemic is that this oversubscription that we live isn't really necessary. But think of a patient, maybe this one, comes into my clinic, busy, stressful day. I can give that patient 60 minutes of calm, 60 minutes of ease and peace and relaxation in a nice, quiet room, nicely furnished, nicely warmed. And I can give her or him the time to relax, rejuvenate, and restore their lives. And I can do all of that without a clinician in the room, with that patient totally alone, while I am able to go off and prepare another client or do something different. So let's have a look at a few more, just so we can see. So 4 treatments, a 65-year-old. So what we're basically saying to you here is look at the inner upper thigh, the difference, the contour, the shape. I suppose we could even, am I allowed to say the firmness? 2 treatments a week, 5 weeks, 10 treatments. So this is body sculpting using the Verju. And this is, as I said, using it on other parts of the body. So we don't need one for the face and chin. We don't need one for the wings. We can use the same machine. So versatility. And yes, like me, even men do it. And again, the difference. So this is basically a collection of photographs using both Verju and Zerona. And it just shows you the potential of this machine. And hopefully you could have as much fun with this as I have with them in my clinics. So again, remarkable changes. So again, body sculpting. And I am getting ready to pretty much hand you back over to Simon. And in a few minutes, when Simon has finished, we will deal with questions and other things. So in 2014, the FDA gave a clearance for obesity using Verju. Again, you can see the treatments on the right hand of your screen. And then the whole thing that I'm constantly saying is our body has everything it needs. Sometimes it just needs a kick in the pants to do it, to do the things we want it to do. That is pretty much where laser comes in. If you remember back at the beginning, I spoke about, I drew your attention to the mitochondria within the fat cell. For years and years and years, we all thought that the mitochondria was just something that was the powerhouse driving the cell. I think with recent research, and if you go through the citations that I've stuck up there, you'll find that the mitochondria has become very important in terms of our understanding of health, in terms of the way we deliver health, and in terms of what we can do if we can assist mitochondria to do what they are supposed to do. So as we age, we lose mitochondria. If we use laser, we get them back. That's all for another lecture. But the most important thing about this is we need to have a healthy inside and not just a healthy looking outside. I can use my fillers, I can use my Botox to get the appearances that I want on the outside. Now, with these lasers, as a side effect, I can have that beauty inside. So I'm going to go draw my conclusions and then hand you back to Simon. But I think conclusions, non-thermal low-level laser, it has a global effect on the entire body. It's productive in use from pain management to fat cell management, even into immunology and neurological management. And it has positive effects because our cells, like spoiled children, they need to learn. And if we can re-educate ourselves, then basically the potential of our life is reopened out again. So the clinical effects of laser on the body are profound. The research that I've presented here and in the series of lectures that I've done to date, if you go back over them, you will find that there is a library of information in support of the beneficial effects of these devices, not just in fat cell management, but in pain and neurological management as well. So I am, when I can do this, going to hand you back over to Simon. And Simon will continue from there.
That's great. Thank you, Robert. Thank you for that. Very insightful. I'm going to transfer across to my screen now. So hopefully everybody will be able to see that now. Can you see the desktop, Robert?
I can.
Right. Well, what I'm going to do is I'm going to first and foremost bring up the slide that Rob wasn't able to share earlier, which shows the delivery mechanism of the laser and the delivery of photonic energy and how it works with the body. So if you can bear with me, please. Would you like to talk through it, Rob?
Yeah, so basically what you're looking at is the bubbles, first of all, are telling us that the cascade effect is working. And what you're going to see now in a minute is you're going to see that fat start to move out of the cell through a single transitory pore. The important thing with all of this is it's a single transitory pore. You're not damaging the fat cell. It's coming out through one transitory pore, as I showed you in the electron microscope, I can never say that word, the electron microscope film. And that transitory pore closes up. So again, here comes the laser. It's basically creating that exit for the fat, expressing it from the system into the lymphatics, and the chemical cascade we spoke about on the second slide. So back to you, Simon.
I think this was the other slide, Rob, that you were talking about before.
Yeah, it didn't come up for me. So basically, this is what happens when we overlay the data one on top of the other. And we were talking about the 25% difference here between the red laser and the green laser. Like for me, it's a total no-brainer. I mean, the way that this works in my practice, I mean, I took these devices into my practice in the last recession, expecting to go broke, and instead of that, it basically completely changed. I mean, I've gone from a single person in practice to a group of practices. Like I'm employing 9 people. We work across private hospitals, public hospitals, with these devices. So I think even at the moment, we have patients coming in here every single day. We're giving them free lasers to boost their immunology. So those patients will remember that when this is over. But just back to that graph, that's just to show you the difference between red and green.
That's brilliant. Thanks a lot for that, Rob. And thanks for your whole presentation. What we are trying to get across here to everybody isn't just necessarily about the laser and how it works, but it's also the positive side effects that can be obtained from having these treatments. As Robert alluded to earlier, most technologies out there, whether it's through excessive heating or whether it's through excessive cooling, are able to actually demonstrate some sort of result by destroying the fat cell. Now, we take great pride in the fact that our technology doesn't do that. We believe in the endocrinal function of the cell and the effects that it can actually have for balancing out the metabolism. So that's a very important message to us, and why Robert alluded to the Verju experience. So very rarely now do we talk about the Verju laser. We talk about the Verju experience or the Zerona experience, because we're not just looking at a clinically proven aesthetic result. We're also looking at the positive health effects that having treatments with these lasers can actually have on your patients. So you can look at it from an overall perspective. You can look at it from, yes, clinically proven through multi-center, placebo-controlled, double-blind, randomized studies, but also by way of showing the patient a healthy approach. And one of our new slogans is probably the healthiest, most relaxing medical treatment on the market ever, which we believe it is. You know, we're also able to look at the patient's cholesterol drop. We're also able to look at leptin levels. We're able to look at the systemic effect that the laser can have on the fat cells. So it starts these communication cascades that go up and down the body from cell to cell, which goes back to the slide that Robert showed of 689 patients where hips, waist, and thighs were measured as part of the treatment, but also ankles, knees, upper abdomen, chest, and arms, because we wanted to prove that the fat wasn't being redistributed to other areas of the body. And not only did we actually prove that, but we also noticed small reductions of the other areas of the body, which weren't even being treated. And that is to do with the systemic effect, this communication cascade, which is actually caused by the laser. And Rob's presentation next week will be covering a lot more of the health advantages in more depth and looking at things like, you know, the cellular anti-aging, the effect the laser can actually have on the aging process at a cellular level, because we all lose mitochondria as we get older and we're all more prone to catch disease or catch infection. We lose our energy. So through treatments of the laser, we're able to reverse this cycle to a certain extent, make the patients feel better about themselves, make them have more energy, make them able to actually fight infection and fight disease a lot more effectively by boosting their immune system. So I hope you will all tune in for next week. What I'd like to cover at the end of this presentation, and apologies about the beeping of the email, it's quite incessant for me, unfortunately. As you can see on the screen now, this is our new brochure, product brochure. So Robert alluded to it, I think, in his third or fourth slide, which looks at the areas that you can actually promote the lasers and optimize low-level laser therapy. Now, Erchonia's bread and butter business is to do with accelerated healing and pain management, and they hold 17 of the 20 US FDA clearances given to low-level laser therapy. We like to make that point because there's a lot of false pretenders out there, or there's a lot of maybe lack of understanding as to what non-thermal low-level laser therapy is, or we say true non-thermal. As soon as you start reaching, the 700 nanometer plus, then you start coming into the infrared spectrum, and the higher the wavelength of laser goes, the less energy you deliver and the more heat. The lower the nanometer goes, the more energy you're delivering. And we do it, as Rob alluded to, via very low hertz, because we don't want to generate a heating effect. We don't want to take away the amount of energy that's actually delivered to the mitochondria of the cell. And you can't patent a wavelength of laser, but what you can patent is the delivery mechanism of this laser. So Erchonia spent years of research looking at the best way to deliver this dose of photonic energy. They looked at fat pads on the body. They looked at laser points. They looked at line coherent beams, and the research showed them that the line coherent rotating beam was actually the best way to optimize photonic energy delivery into the mitochondria of the cell. Now we have billions of photons actually going into the body per second, and it really only needs one photon to actually demonstrate an effect on something. So through this patented mechanism of action, that's what enables us to harness the benefits of the low-level laser technology and optimize the performance of it. So we try to move away from categorizing it in one box, because we've proven over the amount of years that we've been in business that we are global leaders in non-thermal low-level laser technology. The pictures on the screen there, as you can see to the right, that's the Verju and the Zerona system, which Rob alluded to before. The EVRL, the purple laser, Erchonia violet and red laser, is becoming very popular, not just in pain management, but also in medical aesthetic and dermatology practices. Not only have we got an FDA clearance for acne with this laser, a lot of the clinics who have the laser use it very effectively on rosacea, on eczema, on psoriasis, on a range of skin conditions. And it's also used a lot in wound healing. So whether that be in plastic surgery circles, or whether that be in orthopedic circles, the violet laser is antimicrobial, so it obviously fights infection and bacteria, whereas the red laser is rejuvenating, and that's what will accelerate the healing process within the wound. So we've received a lot of very good pictures through recently from a lot of our clinics showing how wound healing is accelerated by at least 50% on a lot of cases by using this laser. We came from very humble beginnings. I'd like to include this on this presentation because, I came across this technology back in 2012 and contacted Erchonia because I knew a lot about the industry. I used to consult a lot onto clinics as to what sort of technologies to get. And frequently clinics would actually, or doctors of clinics or owners of clinics would say to me, we have this device, it's FDA cleared. We have another device which is FDA cleared, which is great. It gives a certain level of credibility. But what I used to say to them is that's fantastic, but also you need to expand on your questioning when it comes to FDA cleared lasers, because there are a lot out there that piggyback off others and get a clearance based on somebody else's results. So the questions you should be asking is, how many patients participated in the study? Was it placebo controlled? Was it double blind? Was it randomized? It's very easy to pick out the patients that you think will respond best to treatment, but what clinics and doctors need is a pragmatic viewpoint. I mean, we're talking about a medical treatment here and not all medical treatments work on every single patient. So by just picking out the patients who we feel would respond better isn't providing you with a pragmatic approach in clinic. Studies are specific to proving the safety and efficacy of a specific treatment, and it's always on a pre-agreed set protocol. Now, that pre-agreed protocol might not be in the best interests of the patient that's participating in the study, and this is where the training and support comes in, which we provide as a unit all over the world, but specifically in my unit, which is for Europe, Middle East, and Africa. We need to make sure that you guys are aware as to how to optimize the performance of the laser in clinic. And this involves looking at the protocol. It involves looking in depth at the consultation and the questions you should be asking. And it also involves in looking at diode placement, where the diode placement should be. Every patient presents a different opportunity, and every patient reacts differently. So of course we have our pre-agreed protocols, but we very much teach you as to how to look at each patient as an individual and enable you to formulate the best treatment plan you can for that specific patient. I could quite easily do 6 treatments on one patient, 3 treatments a week for 2 weeks. But is that the right protocol for that specific patient? Are their bodies capable of metabolizing the released fat that comes out of the cells? So we have a protocol training plan in place, which we look at patients who are quite obviously okay to metabolize a high percentage of fat very quick. We look at the normal patient, but we also look at those patients which are maybe sort of over 50, maybe post-menopausal, and maybe have had previous surgical intervention. We have a look at their lifestyle, and we can actually adapt the treatment programs specific to that patient. And no matter what technology you're using in your clinic, this is what it's all about, looking at the patient on a patient-to-patient business position and giving them the best advice possible. So this slide I specifically love because, you know, this technology came from an idea like they always do. Mr. Steve Shanks, who Rob discussed earlier in his presentation, and Mr. Kevin Tusek, who's an engineer, sitting down and looking at the research that was available on low-level laser technology and thinking of, you know, how can we make this better? How can we specifically harness this technology and present it to, you know, the medical world in varying different formats and varying different, you know, medical conditions? So it started off in a little house in Florida, and it's made us what we are today, and that is a family business that doesn't just produce quality laser engineering, but, you know, we care about people. We very much try to run our business like it's a family business, and we look out for the best interests of our customers. This is one of the early models that Erchonia first started way back. So you can actually see from that picture, you know, how this has actually moved forward, where we've moved forward to. So, you know, we don't like to rest on the laurels. We don't like to think that we've got it cracked. We spend over $5 million at any one time on research and development because we like to look at what we've got and we like to come up with solutions as to how we can make it better. This is our engineering workshop, which is in Melbourne Beach in Florida. So as it says from the slide caption there, you know, we don't rely on other people actually making our technology for us. 85% of what we do, we are self-reliant on. So we order the parts in and we actually manufacture the lasers in our workshop in Florida. And we've got all of the necessary regulations that we need for whichever market we want to go to. The FDAs, the ISOs, the CE markings. It's also important to realize that as of 26th of May, medical device regulations are changing in Europe. And this is going to be a major benefit for everybody involved because it's going to stop a lot of the lesser devices that don't have specific studies to prove their technology coming into the market. And it should leave behind a lot of the companies and a lot of the technologies that invest a lot into the efficacy of the technologies and the placebo-controlled double-blind studies. So we're going to be doing a lot more studies in Europe as well, not just relying on our US company to provide them. So we were the first to actually get a low-level laser FDA clearance, which was neck and shoulder pain, and that was in 2002. And as I said before, we've gone on to achieve 17 more, all specific to pain management, accelerated healing, fat loss, body sculpting, reduction in the appearance of cellulite, and also onychomycosis. Not just in the US, but when the US actually deliver the lasers into our office in Oxfordshire in the UK, it goes through a stringent quality control process. It does before it leaves the US. And then we also do it when we receive the lasers into our office facility in the UK, before we then forward the lasers on to Europe or the Middle East or Africa. So that's an important point to make regarding the quality. We handle all aspects of the of getting the lasers out there. A lot of the boring behind the scenes stuff when it comes to the regulations and the research and development, but we also handle the distribution, the marketing, the customer support's a very important part, and it's an area where I'm sure our existing customers would say that us in the UK, we really put a lot of credence in this, and we reply to a lot of queries in a time-sensitive matter, and we do it with urgency. So that's something that, in my mind, the way I set companies up is just as important as the laser technology. So we also have a huge file of marketing collateral for you to actually use to help you commercially. And we're doing what we can at the minute for anybody interested in looking at the lasers by providing a cost-effective alternative for you. It's difficult times, as Rob alluded to before, with this whole COVID-19 situation. So off our own backs, we've come up with 3 to 5 year interest-free credit solutions with also 3 months deferred payment. So we are picking up the bill for that and trying to do what we can to enable clinics to not just rest on their laurels and wait for all this to finish, but to start planning now. This is the time to plan, so that by the time this whole situation finishes, you're actually in a prime position to push forward, and you're in a better position than a lot of the clinics who decide to just see how it pans out before making any decisions. Use this time effectively, guys. We promote this to our existing customers to do what they can to offer not just solutions for when their clinics reopen, but there are a lot of solutions that we can actually provide to use the lasers at home, especially to build and boost the immunity. So yeah, it's a very good time to come on board at the minute, guys. This is the presence that we have around the world, and I don't think you'd get anybody that would argue with the fact that we aren't global leaders in low-level laser therapy. We invest a lot of money into proving this, and it provides you, the doctor, or you, the clinic owner, with the reassurance that you're actually providing a treatment, a solution to your patients on a technology that's been tested and studied more than probably any other technology out there, especially in this market. So I'd like to finish off by just talking about Rob's presentation next week. We're going to look a lot more in depth into the health aspects of providing the lasers treatments to your patients, the visual experience, which provides, as I said before, not just the most clinically evaluated and the safest medical treatment, but also the most relaxing for your patients. So we guide you and we show you how to create an experience for them, an experience where they might have to come back anywhere between 6 and 10 times, but they look forward to coming back. You know, life is so busy, there's so much to do, whether it to be with work, with the family, with the kids, with whatever. Actually, we all forget about ourselves from time to time. So to actually come into the clinic and have this treatment, a lot of our patients that are being run through the clinics that we have on board really look forward to coming in to get their treatment. They find it relaxing. They come out of the treatment more energized. They come out, I suppose, with a better mental health, because we all take on board too much stress in our lives. And sometimes it's important just to take one step back and press the reset button. So that's what we advocate, and that's what we'll be working with you in depth on, to give yourselves and your patients a better solution. So at this juncture, I'd like to look at some questions that we get through. Rob, if you're still there. We've had a couple of requests here to make sure that we send a link to this video and also to the previous webinars done, which we will do. Let's have a look further down here. I have I don't want to say the brand, it's a cryolipolysis device. Can you tell us a little bit more, please, about the difference between cryolipolysis and Verju?
I think for me, it's quite simple. I'm a medic. My primary thing is to do no harm. World Health Organization basically turned around and said that our fat cells are part of our endocrine system. So let me ask you a question. If I came into your clinic and I said to you, would you do me a favor? Can you freeze my liver for me, please? Chances are you're going to say, no, I can't do that. So then my next question would be, why would I freeze a fat cell? It's part of my endocrine system. It's responsible for so many things. Is it a good system? Is it a bad system? I don't know. That's not my place to call. For me, I want systems that I can use that do no harm. Does cryolipolysis have a place? That's a question for the individual clinician who uses it, and it's a question for really the companies who sell them. But from my point of view, I prefer to take the gentle, painless approach. Cryolipolysis is painful. I've had it done to me, and maybe it's just because I'm a man and we don't have babies, but I definitely didn't like it. Not sure if that answers your question, but that's my answer.
Yes, it does. Thanks, Robert. I've got a question for you, actually, Rob, because I can see a lot of the studies that you do, a lot of the research you do behind the scenes. Now, I found it very interesting, the research that you specifically did on pre-diabetes in obesity management. We'll allude to that in more depth, I think, in one of the future presentations. But can you just summarize what the point of this research was and summarize the conclusion that you came up with, please?
I think the big thing was, at the moment, we're in well, before this current epidemic, we're in a global epidemic in terms of diabetes and weight management. And one of the things that I always questioned was how much of diabetes is actually really weight related. And if I have a way of controlling my weight, can I then control or prevent diabetes from developing? So what we did was I set about putting together a study where we took two groups of patients. Both groups of patients had exactly the same diet. Both groups of patients had the same exercise routine. One group of patients had the laser treatment. The other group of patients didn't. They were all diagnosed as pre-diabetic. So we did the study 18 months later. All of the people that had the Zerona, which I used, had a positive response. None of them had gone on to develop diabetes. They'd all lost considerable weight, and they were all happy, healthy, supporting each other. On the placebo group, where we used the LED, it was interesting because all except one had gone on to develop diabetes, and we had actually, I think, lost two of them to comorbidities. And when we put the two groups side by side and we calculated, I think it was their BMIs we calculated. When we calculated a mass BMI, the difference between the two of them was absolutely huge. I think over the course of the study, in terms of weight that we had lost, there was, I think it was a 40% difference between the active and the passive group. So I think using this outside of the box in prediabetes and obesity management, we can get to a situation where we prevent diabetes from actually developing. I think the side effect that we noted from that was we had patients that would have had early onset development of peripheral neuropathy and stuff like that. All of that abated. So for me, lasers are an invaluable tool in my everyday box.
Great, thanks for that, Rob. There's a generic one actually here asking about using adjunct therapies with Verju or Zerona. Now, I'll start off by answering that, and Rob can obviously chip in if he would like. In the studies that Erchonia did, the studies were no lifestyle changes. So the patients had to sign an affidavit to say that they wouldn't change their diet and their exercise, that they carry on doing it exactly how they were. Now, in the first Zerona study, I remember we lost 3 patients from that study because you could actually see from the food and exercise diary that the patients were keeping, they subconsciously were dieting. And of course, when we put one of these studies forward to the FDA, we want to be able to prove what happens with just using the laser, not by adding other adjunct therapies, not by adding diet and exercise. And I know of a specific technology that got an FDA clearance. I think it showed 2.5 centimeters of reduction, but it was also with 30 minutes of cardiovascular exercise straight after. So all of the results that we provide you with from the studies is just the measurements from the laser technology, nothing else. However, as Rob alluded to, and as per the animation that he's just shown, or I've just shown, obviously, if the patient has a better lymphatic flow, the fat that's been released into free fatty acids from the Verju or the Zerona treatment, it needs a way of getting out of the body. And we know that the lymphatic system relies on 2 main things. That is hydration and mobility. So when the patient actually comes into the clinic, the key advice is just do what you can once you leave the clinic to make sure that you hydrate, and also small lifestyle changes. If they enjoy going to the gym, they can carry on going to the gym. If they enjoy walking, carry on walking. What we actually say with the lifestyle changes is more beneficial to the patient by way of, we all get a bit lazy, I think, in everyday life. So if you have an opportunity to walk 30 minutes down the street rather than drive 5 minutes, do it. If you go to your hotel or you go to your office, rather than getting in the lift, go up and down the stairs. So there's small things that you can actually do to actually enhance your lymphatic flow. If you enhance your lymphatic flow, obviously the fat that comes out of the body will be able to disperse more out of the body if the lymphatic system is operating better. So this is something that's covered a lot with the patient and with the clinic in training and the patient consultation, so that they know what we would expect from them. We've demonstrated the laser works very well without any adjunct therapies. However, anything that you can do to enhance, the patient's lymphatic system, then obviously that will improve the overall result. So you get the 11 centimeter off 3 area result for Verju. You add hydration, you add walking. You might want to add something in clinic if you have it, like endomology or pressure therapy, or even a vibration plate or a little trampoline. Anything that just gives a little bit of mobility to the patient and enables them to then metabolize more of the Verju released fat is better for the overall treatment. Now, body sculpting, we treat slightly differently to obesity management, and Rob does a lot more obesity management. So obesity is a disease, and it's a disease whereby the patient needs a lot more than just generic advice like that. So Rob and a lot of the obesity clinics that we have on board, they obviously look into the nutritional side of things with the patient. A lot of them also look into psychotherapy, and they look at other ways to help the patient, not just reduce more fat, but also from a mental level. So is there anything you want to add to that, Rob?
No, I'm good, thanks.
Brilliant. Let me have another look. There's another one obviously asking for the link. There's somebody asking about pricing. Now, I didn't really want to go into that on this presentation because this was very specific to education, to knowledge, to showing you a different way of doing things. I'm more than happy to follow up with a pricing email, let you know what the pricing structure will be. In the next couple of weeks, we'll probably do a commercial presentation on this as well, because it's not just enough to get a quality device which gives quality results. You obviously need to make sure that you get a very quick return on investment. And we have a lot of case studies from a lot of our clients. We have over 16,000 lasers in clinic alone, just in North America, and more around the world. But we will also advise on how to get a quick return on investment, what to do behind the scenes to make sure that you make people aware of this, because it's great having it, but people need to know what you're doing. So we look at all aspects of marketing, collateral, social media, which has become more prominent now than it ever used to be. And we look at another wide variety of marketing options as well, and give the best advice we can. So I hope that answers your question. Doesn't appear to be any more. So at this juncture, I'd like to really thank Rob for being you. In all the years that I've known you, yes, obviously you have your clinical expertise, but one of the nicest things I can say about you is you're a quality individual. You actually care for people and care for patients, and that very much echoes what we stand for in Erchonia. So thank you very much, Rob, and have a safe time at home, everybody, and stay well and stay healthy, and we will tune back in with you very soon. Thank you.
Thank you.